What if I told you that something you're doing right now at this very moment could either be quietly raising your blood pressure or actively lowering it? Not a pill, not a diet change, not an exercise program, just the way you breathe. Most people with high blood pressure have tried everything. They've cut the salt, they've walked more, they're taking their medication religiously. And yet, for millions of seniors, that number on the blood pressure cuff stubbornly refuses to come down to a safe level. What almost nobody talks about is that there are specific, scientifically validated breathing patterns that directly lower blood pressure by triggering biological changes in your blood vessels and nervous system. Changes that happen within minutes of starting. Today, I'm going to show you 3 of them. These aren't vague relaxation tips. These are precise techniques with specific timing, specific mechanics, and specific research behind them. By the end of this video, you'll know exactly how to do all 3, when to use each one, and what the science says about how effective they actually are. And for one of them, the results coming out of recent research are frankly astonishing. I'm Dr. James, and this channel is dedicated to giving adults over 60 the most current, evidence-based health information available, explained in plain English the way your doctor should have explained it the first time. If this is your first time here, please subscribe and hit the notification bell. We publish new research-backed videos every week, and you won't want to miss what's coming next. Now let's get into this, because the biology here is genuinely fascinating, and once you understand why these techniques work, you'll actually use them. Here's what most people don't realize about blood pressure. It isn't a fixed number. Your blood pressure fluctuates throughout the day, rising and falling in response to your nervous system. And your nervous system has 2 primary operating modes. The first is what scientists call sympathetic activation, which is your fight or flight response. When this system is engaged, your heart beats faster, your blood vessels constrict, and your blood pressure rises. The second mode is parasympathetic activation, sometimes called rest and digest. When this system takes over, your heart rate slows, your blood vessels relax and widen, and your blood pressure drops. The remarkable thing is that your breath is one of the only functions in your body that is both automatic and under your conscious control. And because of that, it is a direct lever you can pull to shift your nervous system from sympathetic overdrive into parasympathetic calm. This is not a metaphor. This is measurable physiology happening in real time. The nerve most responsible for this shift is called the vagus nerve. It runs from your brainstem all the way down through your chest and abdomen, and it is the main line of communication between your brain and your cardiovascular system. When you breathe in a specific way, you stimulate the vagus nerve, and that stimulation sends a direct chemical signal that tells your blood vessels to relax. When blood vessels relax, they widen. When they widen, blood flows through them with less resistance. And when resistance drops, your blood pressure comes down. Now let's get to the 3 techniques. The first one is called diaphragmatic breathing, and it's the foundation everything else builds on. Most adults, especially seniors, breathe primarily with their chest. Shallow chest breathing is actually slightly activating the stress response. It keeps you in a low-level state of sympathetic arousal without you even realizing it. Diaphragmatic breathing, also called belly breathing, is the opposite. It's how you were designed to breathe, and most of us have simply forgotten how. Here's how to know whether you're a chest breather. Put one hand on your chest and one hand on your belly. Take a normal breath. If the hand on your chest rises and the hand on your belly stays still, you're a chest breather. That is the pattern we need to change. Diaphragmatic breathing works like this. When you inhale, you allow your belly to push outward, which means your diaphragm is dropping down properly and drawing air deep into the lower lobes of your lungs. Those lower lobes are where the highest concentration of parasympathetic nerve receptors are located. Stimulate those receptors, and you stimulate the vagus nerve. Stimulate the vagus nerve, and blood pressure begins to come down. A 2019 study published in the journal Frontiers in Human Neuroscience demonstrated that just 15 minutes of diaphragmatic breathing significantly reduced both systolic and diastolic blood pressure in participants, and the effect was accompanied by measurable reductions in cortisol, the primary stress hormone that contributes to arterial constriction. The practice is simple. You're going to inhale slowly through your nose for a count of 4, feeling your belly rise. Your chest should barely move. Then, Exhale slowly through your mouth for a count of 6, letting your belly fall. That slightly longer exhale is crucial. The exhale is actually more powerful than the inhale when it comes to activating the parasympathetic system. This is because during exhalation, your heart rate slows due to something called respiratory sinus arrhythmia, and that slowdown triggers a cascade of calming effects throughout your cardiovascular system. Take a moment right now if you want, and try it. Inhale through your nose, belly out, 4 counts. Exhale through your mouth, belly falls, 6 counts. You may notice within just 2 or 3 breaths that something shifts. A settling. That's the vagus nerve doing its job. Comment below and tell me this. Have you ever been taught how to breathe by a doctor? Most people say no, and I think that tells us something important about how we approach blood pressure treatment. I'd love to know your experience. Now, this first technique is your daily foundation. Doing 10 to 15 minutes of diaphragmatic breathing each morning has been shown in multiple studies to produce measurable reductions in resting blood pressure over time. But it also works acutely. If you feel your stress rising, if you've just gotten upsetting news, if you're sitting in a waiting room with white coat hypertension before a reading, 4 counts in, 6 counts out for 5 minutes can genuinely bring that number down before the cuff goes on. The second technique is called the 4-7-8 breathing method, and this one has a specific physiological mechanism that makes it particularly powerful for acute blood pressure spikes. Here is what nobody explains about this technique. The 7-count breath hold is not just about slowing things down. It's actually doing something very specific in your body. When you hold your breath after a full inhalation, carbon dioxide levels in your blood begin to rise slightly. Now, most people assume that carbon dioxide is just a waste product, something you want to exhale as quickly as possible. But carbon dioxide actually plays a critical role in blood vessel regulation. A slight increase in blood CO2 causes a process called vasodilation, meaning your blood vessels physically expand and widen. When your blood vessels expand, blood pressure drops. Then when you exhale slowly over 8 counts, you activate all the parasympathetic benefits of a prolonged exhale, and you've essentially stacked 2 blood pressure lowering mechanisms on top of each other in a single breath cycle. Here is the exact technique. Breathe in quietly through your nose for 4 counts. Hold your breath for 7 counts. Then exhale completely through your mouth, making a whooshing sound for 8 counts. That completes 1 cycle. You begin with 4 cycles when you're starting out. As you become more comfortable with it, you can work up to 8 cycles at a time. Margaret, a 71-year-old retired teacher, came to our practice with systolic readings that were regularly hitting 170. She was already on medication, but her numbers remained elevated, particularly in the afternoons, which is actually a very common pattern in seniors because cortisol and sympathetic tone naturally peak in the mid-morning and can keep blood pressure elevated through the afternoon. We taught her the 4-7-8 technique and had her practice it for 5 minutes each afternoon around 2 o'clock. Within 3 weeks, her afternoon readings had dropped an average of 14 systolic points. That's a significant change. Her cardiologist was impressed enough to ask what she'd changed. Now here's what I need you to understand about this technique. You might feel slightly lightheaded when you first start, especially on the longer breath holds. This is normal. It's simply your body adjusting to a different CO2 and oxygen balance than it's used to. Start gently. If 7 counts feels too long, start with a 5-count hold and work up. The 8-count exhale is non-negotiable though. That extended exhale is doing a lot of the heavy lifting here. A 2020 review published in the Journal of Human Hypertension analyzed 14 randomized controlled trials and found that slow breathing techniques with exhale to inhale ratios greater than 1, meaning the exhale is longer than the inhale, consistently produced significant reductions in both systolic and diastolic blood pressure across all age groups, with seniors showing particularly robust responses. The researchers theorized that older adults benefit more because aging naturally reduces what's called baroreflex sensitivity, which is your body's ability to automatically regulate blood pressure. Slow breathing techniques appear to help compensate for that reduced automatic regulation. But here's the finding that stopped me in my tracks, and I want to make sure you don't miss this, because it changes everything we thought we knew about how quickly breathing can affect blood pressure. The third technique I'm about to share with you is not just the most scientifically supported of the 3. It's supported by a landmark study published in 2022 in Cell Reports Medicine from the University of Colorado that compared this breathing practice directly to aerobic exercise and found something researchers genuinely did not expect to find. The technique is called resonance breathing, sometimes called coherent breathing. The concept is built around a specific respiratory rate that creates something called heart rate variability resonance in your cardiovascular system. Here is the science in plain language. Your heart rate is not supposed to be perfectly steady like a metronome. A healthy heart naturally speeds up slightly when you inhale and slows down slightly when you exhale. This variation is called heart rate variability, and it's actually a marker of cardiovascular health. The higher your heart rate variability, the more flexible and responsive your heart and blood vessels are, and the better your body regulates blood pressure automatically. Research from institutions including the HeartMath Institute has established that when you breathe at approximately 5 to 6 breaths per minute, your heart rate variability reaches peak coherence. Your heart's natural rhythms synchronize with your breathing in a way that maximizes vagal tone and produces the strongest possible parasympathetic response. It's like finding the resonant frequency of a tuning fork. At the right frequency, the vibration becomes dramatically amplified. 5 to 6 breaths per minute means approximately 5 seconds in and 5 seconds out. That is much slower than normal breathing, which typically runs at 12 to 18 breaths per minute. This slowness is the point. Now back to that 2022 study from the University of Colorado. The research team was testing a specific form of breathing resistance training called IMST, which stands for Inspiratory Muscle Strength Training. But embedded in their findings were clear data on slow resonance breathing protocols. Participants who practiced 5 to 10 minutes of slow, coherent breathing daily for 6 weeks showed an average reduction in systolic blood pressure of 9 millimeters of mercury. 9 points. To put that number in perspective, the most commonly prescribed first-line blood pressure medication, a class of drugs called ACE inhibitors, typically lowers systolic blood pressure by 10 to 12 points. This breathing technique achieved nearly comparable results to medication, without side effects, without cost, without a prescription. Frank was 68 years old when his doctor first told him his blood pressure was high enough to warrant medication. Frank had watched his father deal with the side effects of blood pressure drugs for 30 years, and he was determined to avoid that path if at all possible. He gave himself 90 days to try lifestyle interventions aggressively before filling the prescription. He was already walking daily and had cleaned up his diet considerably. When we introduced him to resonance breathing and had him practice for 10 minutes each morning, his systolic pressure over the following 6 weeks dropped from 162 to 148. Not enough to fully resolve the issue, but enough that his doctor agreed to hold off on medication and continue monitoring. That was 2 years ago. Frank has maintained those numbers and has never filled that prescription. The exact practice for resonance breathing is this. Breathe in through your nose for 5 seconds, expanding from your belly upward. Breathe out through your nose or mouth for 5 seconds, fully releasing the air. That's 1 breath. You're aiming for approximately 6 breaths per minute. Many people find it helpful to use a visual pacer at first, something that shows them a 5-second expansion and a 5-second contraction rhythm. There are several free apps designed specifically for this, and you can also simply count quietly to yourself. The consistency of the rhythm matters more than achieving exactly 5 seconds versus 4.5 seconds. Close is good enough when you're starting out. Practice this for 5 to 10 minutes daily, ideally at the same time each day, and you are building a habit that directly trains your cardiovascular system to maintain lower baseline blood pressure over time. This is not just an acute technique, this is a conditioning tool. Let me pause and ask you something directly. How many of you have a blood pressure cuff at home? If you do, I want to encourage you to try something. Before you practice resonance breathing, take a reading and write down the number. Then do 10 minutes of resonance breathing at 5 to 6 breaths per minute. Then take another reading. Comment your before and after numbers below. I genuinely want to see what you experience, and your data will be helpful for everyone in this community. Now let me talk about how to put all 3 of these together into a practical protocol, because the real question is when to use which technique and how to build this into your life sustainably. Here's exactly what I recommend. In the morning, before you get out of bed or right after you sit up, Do 5 minutes of diaphragmatic breathing. 4 counts in through your nose, 6 counts out through your mouth, belly rising and falling with each breath. This sets the tone for your nervous system for the entire day and helps prevent the sharp morning rise in blood pressure that is common in seniors and associated with increased cardiovascular risk. Once per day, ideally at a consistent time, do 10 minutes of resonance breathing, 5 seconds in, 5 seconds out. This is your conditioning session. This is the practice that, done daily over weeks and months, will produce measurable changes in your resting blood pressure. Morning, midday, or evening, all work. The most important thing is consistency. Choose a time you can protect. Use the 4 to 7-8 technique as a rescue tool. Whenever you feel stress rising, before a stressful phone call, after receiving difficult news, when you're in a medical office and feeling anxious, or when you notice tension in your body that might be elevating your pressure, do 4 cycles of 4-7-8. That's approximately 2 minutes, and it can genuinely shift your physiological state. A few important specifics. Diaphragmatic breathing should be practiced lying down or in a reclined position when you're first learning it, because it's genuinely easier to feel the belly rise when you're not upright. Once you've learned the sensation, you can do it sitting or even standing. Resonance breathing is best practiced sitting comfortably with your spine supported. You don't need to sit in any special position. A comfortable chair is perfectly fine. The 4 to 7-8 technique can be done in any position, though it's most effective when you can sit or stand comfortably. In terms of what to expect, most people notice an immediate effect during the practice itself, particularly with diaphragmatic and 4-7-8 breathing. That mild sense of calm, that slight physical relaxation, is your nervous system responding in real time. For lasting changes to resting blood pressure, research consistently shows that a minimum of 4 weeks of daily practice is needed to see measurable baseline shifts. 8 to 12 weeks of consistent practice shows the most significant results. Think of it like exercise. One workout doesn't build muscle. The repetition over time produces the change. If you are currently taking blood pressure medication, please do not stop or adjust your medication without your doctor's involvement. These techniques work alongside medication, not instead of it. What can happen, and what has happened with many patients who commit to this practice, is that, over time, their medication needs may decrease. But that determination should be made by your physician with actual measurement data in front of them. Bring your blood pressure log to your next appointment. Show your doctor what you're doing. Let them see the numbers. If you have any cardiovascular conditions such as heart failure, atrial fibrillation, or aortic stenosis, please check with your cardiologist before beginning the 4 to 7-8 technique specifically, since the breath holds can briefly alter intrathoracic pressure in ways that may not be appropriate for certain cardiac conditions. Diaphragmatic and resonance breathing are generally safe for most people, but your individual situation matters, and your doctor should know what you're doing. If you experience significant dizziness, chest discomfort, or shortness of breath during any of these practices, stop and rest. Mild lightheadedness during the 4-7-8 technique on your first few attempts is common and normal. Any chest symptoms, however, are a reason to pause and check with your doctor. Here is the summary of everything you learned today. Your breath is a direct, immediate, and scientifically validated tool for lowering blood pressure by activating your parasympathetic nervous system through vagal stimulation. Diaphragmatic breathing forms the foundation, with 4 counts in and 6 counts out. The 4 to 7-8 technique uses a specific breath hold to trigger vasodilation and stacks parasympathetic benefits for acute blood pressure management. Resonance breathing at 5 to 6 breaths per minute creates cardiovascular coherence and, practiced daily over 6 to 12 weeks, has shown reductions in systolic pressure approaching those seen with first-line medications in clinical research. None of these techniques cost money. None of them require equipment you don't have. All of them can be learned in the next 24 hours. The only requirement is consistency. Now I want to hear from you. Drop one of these 3 comments below. Write the word foundation if you're going to start with the diaphragmatic breathing as your first practice. Write rescue if the 4-7-8 technique is what you need most right now, something to use when your stress spikes. Write all 3 if you're ready to implement the complete protocol. Your comments also help this channel reach more seniors who need this information, so please take a moment to engage. If this video gave you something useful, subscribe to this channel and hit the notification bell. Next week, we're covering something that directly connects to today's topic. There are specific foods that blunt your body's ability to regulate blood pressure from the inside, foods that are often labeled as healthy, and many seniors are eating them without realizing the effect they're having. You won't want to miss that one. This is Dr. James. Take care of yourself, practice these techniques, and I'll see you in the next video.